Hey guys, Don here. Welcome to Podiatry Practice Mastery. We're helping your practice get to the $1 million mark and beyond. Today's going to be a little bit different and long episode. It's a recording of a presentation I did to a senior center. So my dad is currently with us, kind of dealing with some dementia things, and he goes to this men's club, and so I did a talk for this men's club. This is one of the most favorite things that I do. I really enjoy doing this. I don't do a lot of it right now, but it's something that has a lot of fun. Just to kind of give you the idea, I do bring my laptop. I put up some slides. If you want my slides, just send me an email, don@podiatrypracticemastery.com. I can give you the slides. The title of the presentation is All About Feed for Old Farts. That's what it's called. And really, it's just pictures, and then the name of the condition pops up. So I do it kind of as a show and tell. They have to figure out what it is. It has a lot of fun. I didn't go through hardly any of the slides because of conversation. What I tend to do is I use these visual presentations and I move all the pertinent things to these old people. So I think you're going to like this audio, I hope, and you can kind of see how it interacts in their questions and things like that. Appreciate the invitation to come to speak to this men's club. What is this? Any idea? I have gifts here if anyone gets the question correct. It's kind of a show and tell with some of these pictures. Who said the fungus? Toe fungus. Who said that? There you go. You get a free water bottle.
It's dermatophytes.
Oh, look at that. Dermatophytes. Yeah, there are dermatophytes. There's fungus among us. There's Digger, the dermatophyte. Have you heard the advertisements for Lamisil? So this is something that's quite common as we get older. Nails get thicker. I'm not going to ask who has thick nails, okay? But I'm sure it's a big portion in the room here. I guess the first question is, does everyone with thick nails need to have them treated? No. Are thick nails going to bring you to the grave? No, they're not. But are they hard as heck to cut? Yeah. So you almost need a hedge cutter to cut them, and then it's hard. It's hard to cut them, and I couldn't do it if it on my. Because how do you put your foot up? And so there's usually two problems as you get older with cutting nails, besides the thickness of the toenails. The first problem are the joints, okay, because the joints don't move, and then the second problem is called the Dunlop disease.
What?
The Dunlop. No one knows what that is? It's where your belly dunlops over your belt and you can't get down there to do your toenails. So that's why it's called the Dunlop disease. But this is something that's very common. It is treatable, and I treat people up to the age of probably 80. When they get to be about 90, I don't treat them anymore. I say just kind of live with it. But at 80, there is a medication. There's only really one class of medications that can get rid of nail fungus. Okay, everything that they talk about, the drops and the Vicks Vapor Rub and the things like that, they don't work. Okay, the only thing that works are the oral medications, the pills. And everyone asks me, is it going to hurt my liver? Okay, that's the main concern with these pills, because all medications, you either pee them out through your kidney, it goes through your kidney and you pee them out, or it goes multiple times through your liver and your liver processes this medication. So in order to give this medication, you have to do something called a blood test called a liver function test. And if that's okay, most of my patients, even as they're getting older, you can get rid of this fungus. You have to be on it for about a year. Your nails grow at about 1 millimeter. No one uses millimeters here, but it takes about 12 months for a whole new nail to grow out. And the big problem is incomplete cure. I think the main problem I've seen is that people, they start taking the medication and they stop it, or they don't take it long enough. That's a problem. And then it lives in a warm, moist, dark environment, kind of like our shoes. So I think that if we were in a society that we wore gloves all the time, we would have more hand fungus. But we don't see much hand fungus. The reason for that is because we are in shoes all the time. They're warm, they're moist, it's dark. It's a perfect breeding ground for these dermatophytes. And the medication works very well. I know a lot of people have concerns. The doctors will say, oh, you shouldn't take it, it's dangerous. If you search it on Google, they'll say not to take it. My caveat to that is I would ask a doctor, if you want to take it, ask a doctor that prescribes it a lot. Because if you ask me to prescribe you a medicine for hypertension, for high blood pressure, I think it's dangerous, just because I don't do that all the time. But I give this out like candy, this medication, and it works very well. Not everyone has to have treatment, but this is a big problem, okay? That it's called the fungus, and it also leads to athlete's foot. So many times, fungus in the toenail then goes to the skin.
There's been a big advertising campaign for crystal something to treat this. What do you say about that?
Is it a topical? A topical, right? Is it a lotion or a cream?
Crystals,
A crystal, yeah. So in my opinion, anything topically, there's Jubilee, there's cyclopirox, there's a lot of topical things that you can put on. I think it's just easier to put it in the toilet than it is to put it on your toenail, because it doesn't work. You use it for months and months and months, and I think a lot of doctors, I think patients, they want to do something. And so you give them something, and you say you can use this, but you never ask them how many of the patients actually get their nail fungus cured with those things. And so they're using it for months and months, and then they get discouraged, and then they just kind of give up. So I think all the topical things, they don't really work. Once in a while, we can totally pull off a toenail. If it's only one toenail that is affected, you can pull off that toenail. Okay. Now, any questions or comments about nail fungus? Okay, I'm gonna go ahead.
What will happen if you don't treat it?
Nothing. It might progress to the other toenails. It could progress to the other toenails, but it's not going to take you to the grave. Now, where do you see problems? If they're thickened and then they get ingrown, like in the edges, or if they're thickened and then they get lifted or detached. And if you, for example, hit something when you're walking and it jacks up that toenail, that hurts. So if the nail gets really thick, and sometimes if your shoes are not deep enough and you have a thick toenail, it's going to hit the top of the shoe and it's going to be uncomfortable. Okay?
Would that be transferred from one person to another?
Theoretically, it can. It can transfer from one person to another. But I don't think even if you're sleeping with someone and you're rubbing the toes together, it's going to transfer after a long time. Right? It's going to be hard to do that. Well, the reason I'm asking that, because most men come to the office because their wives send them there, right? The wives say, we're not going to sleep in the same bed until you get this thing figured out, and I have to put them at ease, and I say, okay, buddy, it's not that bad, it's not going to transfer, it's not going to go to your kids, not going to go to things like that. The best comment I got about nail fungus is I was at another group, and there was a guy that said, hey doc, I heard that if you pee on your toenails, it'll make the nail fungus go away. And he says, I've been trying for about 20 years and it hasn't been working. So there's a lot of home remedies, and so that's one that, because it has a little acid in it, right? Your uric acid, and it didn't work for that. So that's nail fungus, okay? Huh? You missed the target. Okay, so this is something else that can happen on the skin, and whoever gets this one's going to get a pair of socks. Any idea what this is? Oh, there it is. Athlete's foot. So I always joke with my patients. They might be a little small, for we might have to give them to their mediums. So this is athlete's feet. So whenever I see patients in the office and I look at their feet and I say, they're usually about 80. I said, sir, are you an athlete? and he says no. And I said, well, you got athlete's foot, so at least you got that going for you. So athlete's foot is actually caused by the same thing that caused toenail fungus and the same thing that causes jock itch. It's all the same. Many times when you're at the gym, it goes from the jock down to the foot, and then from the foot skin into the nails. It all kind of connects. It looks like some scaling on the side of the skin, on the side of the toe. The big concern about athlete's foot, the reason I put these pictures is because most people don't think athlete's foot is on the skin. Most people only see it with dampness between the toes. Many people are familiar with that dampness between the toes. That is an athlete's foot as well. But these can be treated with a topical cream, and you don't really need a pill for this.
The Sulfa help?
Sulfa, not usually like a sulfa. No, usually like terbinafine or Lamisil or ketoconazole, any azole type of medication. You can get those over the counter. And another word to the wise, when you buy things, athlete's foot cream is the same as jock itch cream, but the jock itch one costs a lot more.
Oh, that's good to know.
It's exactly the same component, but I think they can charge more for it because it's it's an embarrassing thing. So buy the foot one.
Back in the day, we called it
Crotch rot, same thing. Yep. So yeah. So I'm not going to show you any pictures.
Keep it PG.
I'm not going to show you. Okay, so this is athlete's foot. This is something that, and if you take the pills for the nails, the skin will resolve as well. So that's an added benefit for many of our patients. We put them on the pills. Okay, athlete's foot. Okay, so this here is something that is actually quite common as people get a little bit older, as they have swelling in the legs. And this is actually the leg, and this is the foot. This is the ankle right here, and it looks all red. It looks brawny. It looks like it's distended. Okay, anyone know? This is kind of a hard one. Anyone know what this is?
Leprosy.
Not leprosy. We can talk about leprosy if you want, but it's not leprosy. Cancer. What was that? Circulation problems. Good. And and I'll explain technically what this is. So the picture on your left there. Thank you. Look at that. What's that? So the left, see that brown that kind of looks like rust on the skin? That rusty color? I don't know if...
Not a bruise?
It's not. It's not. So what this is, on the picture on the left, those are called hemosiderin changes. And I'll explain what hemosiderin... So heme is like iron. Okay? So imagine if you take the blood out of the blood vessel and it goes into the skin because of swelling. It has heme in it, which is iron. And then what happens to the skin is the skin almost rusts. So because it's out of the blood vessel into the skin, and that's why it turns that brown color. So I have many patients, they come in and they say, Doc, I've been scrubbing my legs for months and that brown stuff isn't coming off. And I say, it's not coming off, ever. It's stained the skin. And it's due to chronic swelling, chronic edema or swelling in the legs.
That has to do with heart problem.
It usually has to do with something going on. Either you're sitting on your butt a lot because you get sick and your feet swell up, your heart isn't pumping. Sometimes you need to be on what we call a diuretic or like one of those pee pills. And those are ways of getting rid, or wear compression socks. So there's a lot of ways to help with this type of condition. Now, we have a lot of patients, they come in and they have that. It doesn't bother them. They might wear compression socks. But I see this as a problem because it could lead to something else. This in and of itself, the brown coloration, most people have as they get older. Their color changes, and it looks very similar if you get hit in a bruise and then it turns brown. That's why some people think it's from a bruise, but it's not. It's stuck there. If that's not treated, and the swelling gets worse, what happens is there's a break in the skin. The skin can break, and that's called a venous stasis ulcer. So these are caused by vein problems. The difference is these patients, they might have good circulation, meaning the circulation coming down is fine. So I can feel their pulses, so the blood flow coming down is fine, but the problem is the plumbing going back up. So the plumbing going back up are called the veins. And so if the veins are what we call incompetent, the veins are supposed to open up and then close, open up and then close as that blood is pushing back up to the heart. If they're not working that well, they kind of open up and they just stay open. Okay? And then it just pools. And that's why people get the pooling of the blood. And that's why when you sleep overnight and you have your legs elevated, all that blood goes back because there's less resistance, goes back to your heart. You have no swelling in the morning, but then when you get up and put your feet down, everything swells up. And it's because of the veins aren't working. So sometimes You can go in there and you can block the veins. There are certain veins that are closer to the skin that are called superficial veins. They're closer to the skin.
Does that produce pain?
Not usually. Not usually. Veins don't usually cause pain unless there's a sore or if there's a lot of swelling. That swelling in general causes pain in my opinion. A lot of times after a surgery, the problem isn't so much the surgery, it's the swelling. And so the swelling pushes against the nerves, it pushes against the muscles, it makes everything less flexible because of that swelling, and so that causes pain. What this can lead to are venous stasis changes in the ankle, and then that can open up and create a wound. And what happens with that wound, the thing just drains. It's looking for a portal to get rid of the swelling. So that's the portal, and the only way to get that down is to use really tight compression wraps around the legs. They're called Una boots. I don't know if anyone's heard of an Una boot. It's a really tight dressing that you put on there till the wound closes, and then you put someone in compression socks for the rest of their lives. Now the problem with the compression socks, they're a pain to get on. I don't know if anyone of you have tried that. It's like no human being can really get those things on by themselves. They're really hard. It's true. Who's tried compression socks? Who likes putting them on? No one. There's one. You can get them. There's different levels.
I cut the foot off.
You cut the foot.
Yeah, just cut it right at the
Just
end.
cut it right at the ankle. Then it's easier. There are some tools that you can use. There's one tool that looks like it has half a piece of PVC that's cut, and then there's a couple of straps, and you put the sock on that, and then you put it on. And there's another expensive thing that they sell on Amazon called a Dauphin Donner, which is where it's a big piece of plastic that you put on the sock, and then it just rolls right up your foot. So there are things that you can buy that can help you put them on if you really need to wear them. But they're hard. I don't think I can put them on. They're hard to do. Any questions about swelling and about venous stasis problems?
Is there something you can do to prevent that?
To prevent it.
Yeah, we've already got the problem with blood flow.
Yeah, so if you have this, the best thing that is used to pump up the blood back is actually walking. So there's a natural pump in the back of your calf that every time you step and walk, it pumps the blood back up. That's why when you get sick and you stay in bed for a number of days, or you travel in an airplane, everything gets swollen because you're not using that natural pump. So walking is number one. If you start to have a lot of swelling, then compression socks is number two. And then number three, there are vein doctors. They're vascular surgeons, but there are certain clinics. I want to explain the difference. There are certain vascular surgeons that are in the hospital doing surgery all the time. There are others that do just vein work. They're vein specialists. And so if you have this problem, seeing one of them, because many times what they can do, in your foot, in your leg, there are veins that are out here that are superficial, and then there are deep veins. So the deep veins are important. These ones, many times, they can make them stop flowing. So you stop the flow from the superficial ones, and everything goes deep, and it solves a lot of the problems. So that would be done with a vein doctor.
Are those called varicose veins?
Those aren't called varicose veins. They have a few varicose veins, this patient, this little purple thing. So varicose veins are a little bit different, but the same vein doctor sees them. Not everyone with varicose veins develops something like this. Varicose veins can be up in the thigh. They can go all the way down into the foot. And there are treatments for those where you put like a glue inside of it or you use a laser and it stops it from flowing if they're painful. So varicose veins, if they're painful, they should be treated.
What do you think about wearing compression socks on an airplane?
Excellent. So I think everyone should I wear compression socks when I fly. I don't have that much swelling, but when I fly, I have swelling. So I think it's a good idea. Get a pair when you fly. Good. Questions on that? Those are good questions. I tried to put everything kind of related to... Okay. Let's talk about this here. So any idea... So this is someone's foot. That's the arch of the foot. This is kind of looking from the back, and this is kind of looking from the side.
Fallen arches.
Ooh, very good.
I got one.
Good, got one. Fallen arches, flat feet. Okay, flat feet or fallen arches. Okay, these are younger kids. But the key is when you watch someone walk from the back, if their heel is straight, usually the foot is straight. If it looks like the ankle is collapsing in, and if you look at them and they look like a duck, like you can see the toes on the outside, that actually has a technical name. It's called the too many toe sign. So too many toes. So when you watch someone walk from the back and their foot goes out and you can see their toes on the side, then they have a flat foot. Okay? And what's going to happen with a flat foot is there is a tendon on the inside of the arch, kind of right here on the inside of the arch, that its job is to hold up the arch. Now, you can't get in the military with feet like this, okay? No military duty. This would get you out of the military. Very, very flat foot. It doesn't hurt a lot of people when they're younger. When they're younger, they don't have pain with this. But it tends to affect the tendons over time. The tendon on the inside that holds up the arch, there's a tendon right here that develops tendinitis. Wow. Because it's having to overwork. It's constantly pulling. Not only that, if you have a very flat foot over years and years, the joints are going to move a lot more. And that's going to develop arthritis. Yeah. And that's one of the problems with foot arthritis is because the foot overworks, it flattens, it works the tendons, and then the joints get arthritis in them. Go ahead.
Can orthotics make it heal?
So I think of orthotics like eyeglasses. Okay, when you wear eyeglasses, does it heal your eyes? No, it just helps the mechanical instability in your eye. I do believe everyone, like coming out of the womb, this child should have an orthotic. It's gonna make them feel much better, and it's not gonna allow it to progress. But it's not gonna fix it. It doesn't fix the problem. The way to fix the problem, it's a big surgery where you cut through the heel bone and you shift the heel bone over. It's called a flat foot reconstruction surgery. We don't do that a lot. We don't do that a lot for kids. We usually find by putting them in an orthotic, they're fine. And there's different types of orthotics, but this type of a kid would be very good with orthotics. You know, in a lot of cases, what happens with kids, because you all of you have grandchildren, probably have grandchildren, when they're young, they're fine. But it's as soon as they start their sports, as they're much more active, and it's usually at the beginning of a season that we notice this. Like kids, they start playing soccer, or they start wearing their baseball cleats, or they start in track, and all of a sudden they're couch potatoes, and now they're doing an hour working out every single day, and then they start to complain of growing pains or foot pains or things like this. So I always say number one is the importance of the shoe, and then if the shoe isn't enough, then doing an orthotic. And I wouldn't recommend an over-the-counter orthotic. It's not going to be, and they don't make them for really flat feet like this. They make over-the-counter ones for like the bell curve, the power steps, the Spankos. Those are good for normal feet, but for really flat feet, they don't work all that well.
What's the term fallen arches mean?
Flat foot. So fallen arches would mean this arch is fallen, and this arch is fallen. So where the ankle goes in and the arch falls. Now, I don't see any patients like let's say they're 40 and then they wake up when they're 41 and then their birthday and their arches fall. That doesn't happen. People don't wake up and their arch falls down. That doesn't exist. Usually you have a fallen arch and it gets worse over time. And once you start to have pain, then you actually look at it and you're like, I have fallen arches. It's the same thing with toenails. You don't just go from having no fungus to having all the toenails fungus, right? It's just because your wife pointed it out, then you're like, oh my goodness, now I have fungus. Right. So people have fallen arches, and then over time they develop more and more pain with them. So initially we start with orthotics. If that's not enough, there are different types of braces that we can make that'll give more support depending on where the arthritis develops. And then sometimes we can do cortisone injections and things like that for the flat foot. Okay? Questions about shoes? This is probably a good time to talk about shoes and about flat, things like that. Go ahead. Question?
So,
What is your opinion of the Good Feet store?
there you go.
Okay.
That's my question.
Avoid it like the plague. Okay? I admire good salespeople. They're very good at sales, but you're gonna go in there. They're gonna put you into a new shoe and put these inserts, and they're gonna charge you about $2,200. They're not doctors, okay? And they don't take them back if they don't work. Okay? But I think if you take all of you and I give you just a brand new shoe, you're all going to feel much better. Okay? Just starting with the shoe, you're going to feel better. And then what they do is they go over the counter in the back and they grab one based on your arch size and they put it in your shoe. So please don't go there. Unfortunately, when people are in foot pain, they're willing to pay anything to get out of pain, and they'll go there. And so I have the unfortunate, I see this a lot. Patients go there, they spend all that money, then they're not better, then they come and see us.
You can go to Walmart and buy orthotics.
You can buy, but those really aren't orthotics. So that's what I was explaining. So if you go to Walmart, you step on the Dr. Scholl's thing, okay? Those are over-the-counter inserts. They cost about $60. They last about 6 months, and then they wear out. So every 6 months, you're going to buy a pair. And so it tends to be more expensive, and you're going to need a pair for each pair of your shoes. So if you have let's say you don't need much, if you need a little cushion, okay, that's fine. A little bit of arch support, that's fine. But if you have a really flat foot like that even the really high one isn't going to work. So we scan, what we do is when we think that you need it, we scan your foot with a 3D scanner, and we put a prescription in and we send it to a lab. And then they make the orthotics. They take about 3 weeks to make, kind of like eyeglasses. You send them, you get measured, and we make them, and then we do any adjustments for you. They last about 5 years. If you're getting a good pair, it should last you about 5 years. Go ahead.
What causes ingrowing toenails, and what's the treatment for that?
Okay. Ingrowing toenails. Do you have a shoe question first?
Sure, you have any comments on Birkenstock shoes?
Okay. The shoes that I really like, I think Birkenstocks are a very good sandal. They have Birkenstock shoes as well, right? I think Birkenstock are good. They have a cork inlay that has a good arch support. So Birkenstocks are real popular. In terms of sandals, my favorite sandal these days is called an OOFOS sandal, OOFOS. It has a really good arch support, and if you have a flat foot, patients really like them. I know Hoka has a similar recovery sandal as well with a really good arch support. In terms of shoes, I like Asics, New Balance, Saucony, Brooks, Hoka. All of those are really good brands, but normally I refer to good shoe stores. So in town we have Sneakerama in Worcester, Marathon Sports in Shrewsbury. They're both really good shoe stores. In Red Wing, they have a good Red Wing store if you need a work boot.
I bought those slip-on,
Yeah.
and I like the arch support.
Which slip-on? The Skechers?
Sketch.
Yeah. So those are popular. The Skechers slip-ons, they're popular because they're easy to get on and easy to get off. And I think a lot of people are going to be copying the Skechers. I personally don't recommend Skechers a lot, only because I see a lot of athletes. And you're not going to wear a Skecher for athletics. But I think for everyday use, I think it's fine. Go ahead.
Do you?
Solomon makes a good shoe.
Solomon. Yes, Solomon makes a good hiking boot usually. Yeah,
Their trail running shoes.
trail running.
The most comfortable shoes I've ever worn.
Yep, so Solomon's a very good shoe.
Not my trail run, but
If we're going to go into brands, Keen also has a very good, K-E-E-N, they're very good. A lot of my patients with bunions and hammer toes, they do very well with a brand you may have never heard of called Topo, T-O-P-O, and another one is called Ultra. And they both have really wide toe boxes. And for a lot of patients, they have these hammer toes and these big bunions, and they work well with those types of shoes.
Do you sell any shoes at your
We
office?
only sell shoes that no one else sells around. So we sell one type of shoe. It's called LEMS, L-E-M-S. They're actually, you can look at my shoes afterwards. But they're a really wide toe box. The ones I'm wearing, I'm not going to take them off. But they're really wide toe box shoe because patients that have big bunions and hammer toes, they have a hard time finding shoes that are comfortable. And then the other tip about shoes, it's called the shoe liner test. Has anyone ever heard of that? Okay. Now I am going to take off my shoes and I'll teach you something. So in your shoes, everyone has a liner, okay?
Right.
So this is the liner. There should be, you can see my footprint. There should be a finger's breadth at the front of your longest toe. So see my longest toe right there?
Yeah.
There should be a finger's breadth you should have about a ½ inch in front of that. Most people, if you look at their liners, the toes go all the way to the front of the liner, and the shoe is too small for them. Most people, especially women, are in shoes that are at least a half to a full size too small. They're not having symptoms, but you asked about like ingrown toenails and things like that that contribute to it. That can contribute to it. Go ahead.
What's responsible when you look at the back of a shoe?
Wearing out.
It's slanted.
Yeah.
Is that the way the gait you walk?
Mm-hmm. So the question was, why do our shoes wear out on the outside? So if you look at the outside of the heel, it wears out, and it's because of your gait. So gait means the way that you walk. In order to stay upright, you have to walk from one side of your foot to the other side of your foot. And normally you toe off with your big toe. So you push off with your big toe. Make sense? So if you walked from the inside of the heel to the big toe, you'd fall over. So whenever you land on the outside of your heel, you go through the foot and you push off the big toe. That's why the outside wears out more. And it's supposed to wear out. It's normal to wear out. When you go see shoe people, they're going to say, oh, you have to buy new shoes. You could add, if it's a dress shoe, you can have them just add that portion on the outside. But most things have, and we probably have a lot of engineers, everything is engineered obsolescence in this country. So all of the shoes are engineered to wear out at least at a year. Nothing really lasts a long time. Remember in the days things used to last 5, 10, 15 years for a shoe. They make the materials such that they wear out now.
Can you put a lift on it?
You can put lifts in shoes, a lift on the inside or on the outside, depending. And if you need to, well, a lift would be an ortho. It depends on what condition you're trying to treat. Yeah.
Yeah. My shoes always wear out on the lift
Okay,
side.
so it's going to wear out on purpose because of the way you walk. And so adding a lift won't help that. It's going to wear out no matter. You could go to a cobbler and they can add a little bit more on there. Yeah, or just get a new pair. Yeah, there's still one cobbler in town in Worcester. His name is Carbonaz Shoe Repair. They are excellent. They do.
Why is that a dying breed?
Because everything is just the same reason why you don't have VCR repair people or TV repair people. Because everyone's buying new instead of fixing, because it costs more for labor to fix something.
They don't have any leather shoes anymore.
That's another reason there's very little leather shoes. But Birkenstocks, you can send them back to the company and they'll put a new sole on. Some of these more Echo will do that. Mephisto will do that. There are some shoes where you can send them back and they'll put a new sole on the shoe. Okay. Good question. See? LL Bean, yeah, LL Bean has that. Okay. This thing right here on the big toe joint, and you can see here, this is an x-ray. This would be the toe, this is the bone, and this is something on the top of it. It looks like, you can see it looks like a doorstop on the top of the big toe joint. Here's the big toe joint, and with this toe joint, it can't go up. It's hidden on the top. Any idea what that is? Oh, look at that. Must be a doctor in town. Who's that? So there's a difference between a bunion and halux limitus or halux rigidus, and I'll explain the difference. A bunion, on the bunion is a bump that sticks out the side of the big toe. So the side of the big toe, it sticks out. If it sticks out on the big toe, it's called a bunion. If it sticks out on the fifth toe, what's it called? No, some people call it a bunionette or a tailor's bunion. And I think the reason they call it a tailor's bunion because the tailor used to have their legs pressed all the time when they were sewing. That's why they call it a tailor's bunion. But that's on the outside. Okay, everyone knows what a bunion is. But if there's a bump on the top of it, that's called halux limitus or halux rigidus. And I'll explain the difference. So halux is the big toe. If there's limited movement, it's called halux limitus. If there's no movement, it's called halux rigidus. Okay? And so it all depends on how much movement you have. If I try to move it and I can't move it, and it's obvious, but I'll tell you, it starts out as limitus, and over time it becomes rigidus. Okay? And if that happens, what we do for like a joint like this is you just take and you shave off this bump. And once you shave off that bump, there's better movement. That's limitus. If there's rigidus, it means it's already developed arthritis. And if you only shave off the bump, then it just hurts even more because it's an arthritic joint that's moving even more. So for patients like this, you can do a couple of things. The poor man's method is you get something called it's a bone. That's bone. That's bone. It's called it's because they're jamming against each other on that joint, and it's causing that. Up there you can see it too. It's jamming. The way you treat this, if you don't want to do surgery, you could do a cortisone injection. But the poor man's method is a carbon fiber inlay. So I'll explain what that is. So you can buy on Amazon a thing that looks like the inside of your shoe that's made out of carbon fiber, which is almost like a metal that doesn't bend at all. You put that thing in your shoe and your toe doesn't bend. So the toe doesn't bend, the toe doesn't hurt. Okay, so it works really easy for that. You can make that into an orthotic if you want. You can add that into an orthotic so the orthotic doesn't bend. That's another way of doing it. But if nothing works, then either you shave the bump or you stop the movement completely over the joint, which is called a fusion. There's fusions you do everywhere in your body. You can do a fusion on a toe like that. But this is quite common in people as we get older. So these types of arthritic pains and joint issues can be painful. Okay. Questions about that? Make sense? Okay. Arthritis, but halux limitus. So here's another example. If you look at the joint, so this joint right here is a normal joint. This joint you can see, you can't really see the black. So black is air. So if there's air in there, that would mean there's cartilage. There's no cartilage. That means it's bone on bone. And another thing, when you look at x-rays, if you see the bone is really white on the edge, that means it's sclerotic, and that just means that it's really hard bone. So if you hit bone to bone, it's going to get even harder. So when you look at x-rays, if there's no joint space and there's more whiteness around here, that means it's a harder type of a bone. Also, on the sides, you can see it almost grew bone on the side. See that bone that's grown on the side? And those are called osteophytes, and it's basically your body's trying to fuse the joint on its own. And it tries to build bone to stop the movement so it doesn't hurt anymore.
A lot of hockey players have this problem.
Mm-hmm. And it hurts in the skates as well. Or skates or other shoes if it hits on the top of the shoe, because it hurts there.
That's not a bone spur?
It is a bone. Well, so you could call it, if it was only this, it would be a bone spur, but in the conjunction of the arthritis, it's a little bit more. Yep.
Is that a picture of a knee?
No, that's a toe. That's a big toe joint.
What?
Big toe joint. Big toe joint. Mm-hmm.
Metatarsal.
Yeah, so if you want to know anatomy, this is the metatarsal head. Here are your sesamoids, and here's the toe up here. Yeah, so just to orient you. It kind of looks like a knee. It has a kneecap. 2 kneecaps, though. You don't have 2 kneecaps. Okay. How about these things? Who knows what these things are? Yep. You got one. Callus. Now that's the $1 million question. What's the difference between a corn and a callus? You can eat one. Tacos. There's no difference. Corn and calluses are both the same thing. They're hard skin. They're just hard skin caused by rubbing. The main thing you should know, though, is when we talk about feet, usually things on the top of the toes or the side of the toes, we call corns. So tops of toes, sides of toes are corns. If it's somewhere else on your foot, you would call it a callus. But it's really just the same. They're the same thing if you look under a microscope. And one thing that people, so this is an example of one at the side of a fifth toe. This is a fifth toe, and this is rubbing on the side due to a hammer toe. So the toe is curved, rubbing on the side of the shoe, causing pain. So that we're just shaving that one down. Looks like they had an injection before. Here is one on the outside of the foot. That would be on the fifth metatarsal, right by the little toe, and that's going to cause a big callus there. So calluses, once again, are calluses dangerous? No. Do calluses hurt? Yes. So in certain cases, they can be dangerous when they hurt. Okay. If you have, if you have a callus and you do a lot of walking with a callus, what could happen to that callus? Grow. Okay, it grows. It could get infected. It could develop into a blister. Or what we call an ulcer. Have you ever heard of an ulcer? So a callus is always a precursor of an ulcer. So a callus happens first, and then it develops an ulcer, a wound. And the reason is usually due to the pressure and poor blood flow and something called neuropathy. Okay, when people can't feel their feet, if they can't feel it and then they have a callus, that callus doesn't hurt, they do a whole bunch of walking. Let's say they go on vacation, they do a lot of walking, and then it'll develop into a wound. Okay? So, go ahead.
What do they call when they put a tough tube around the toe?
A tube around the toe?
Yeah.
So there's something that we use called tube foam to protect it from rubbing. So it's a kind of usually a foam, right?
Yes.
Yeah, and that's called the tube foam because if there's rubbing on the toes that are causing calluses, you can put that on the toe to protect it. Mm-hmm. Yep. So I think this one, calluses are important only because they could develop into something else. And this last one, I don't think anyone's going to figure this one out, but this one, it's a callus, and it almost looks like there's a pebble in there, that they're walking on a pebble. Some patients, they come in, it's not just a callus, it's a callus with like a pebble or a corn inside of it. Does anyone know what that's called?
Is that in the bottom of the foot?
That's the bottom of the foot.
Could that develop into a wart?
That's a good question. It could be a wart, but it's the technical term, the non-technical term, we call it a seed corn. Basically like you're walking on a seed or you're walking on a really hard piece of callus on the bottom of the foot. And that you have to trim off the top, and then you carve it out with a razor blade. You carve it out, pull it out, and then you try to offload it with either a pad or an orthotic or something else like that. But that was a good question. Many people come in and they think that they have a wart. They think that they have a wart, but it's really not a wart. But it looks very similar, and under a microscope it looks very similar for a wart. So I'm going to end with talking a little bit about neuropathy, because I think we're coming to the end, right, Bill? Yeah. I got to go see patients, so I'm going to talk a little bit about neuropathy. Has everyone heard about neuropathy? Okay, some have. I'll explain. So there are two different types of neuropathy. There's diabetic neuropathy, and then there's non-diabetic neuropathy. So neuro means nerve. Opathy means like a problem with the nerve, pathology of the nerve, a problem of the nerve. That's a very common problem. I'm going to start with the most common, which is with diabetics. So people that have diabetes, they have an elevated amount of what in their bloodstream? Sugar. So that elevated blood sugar, okay, that blood with sugar in it, it can affect the nerves. And I'll explain why. Blood vessels always go side by side the nerves. A real easy example is if you cut off blood supply to the brain in a baby, it's going to die, it's going to be brain dead in a minute or two because it needs blood supply for nerves to live. What happens is as we get older, people have poor blood supply, poor blood flow, but also the blood has a lot of sugar in it. That sugar, when it gets close to the nerves, causes the nerves to swell. When those nerves swell, they don't transmit the pulses as well, and they eventually start to die. And they usually start to die at the area that's furthest from the spinal cord because they get the smallest. They get the smallest when they're furthest from the spinal cord. In the spinal cord, the nerves are the biggest, and as they go out, they naturally get smaller and smaller. And so that's why it affects people's hands and their feet, because it's the furthest from the spinal cord. And then those nerves, they don't have as much blood flow, and then they start to die. Now, before they die, they start to flicker. I kind of equate it to like a light. Lights, they tend to flicker before they go out. It's the same thing. People with neuropathy that have no feeling, they're the worst off because they don't feel anything. They could step on a nail and they wouldn't know about it. Those are the ones that lead to wounds and ulcers and amputations and all the other bad stuff that goes with that. If it's flickering or if it's painful, that's actually a good sign. And the best thing for it is for you to control your blood sugar. The best thing to reverse neuropathy is really, really low blood sugar. And with a lot of these new medications like Ozempic, and you've heard of these things that people are injecting to get their weight down, it helps bring down the blood sugar. And for some people, it can reverse the neuropathy.
Ozempic would
Ozempic would help as well to control the blood sugar, and then maybe it would help the neuropathy.
Something for non-diabetic.
Okay, so for non-diabetics, if they have neuropathy, it's usually due to some type of a nerve injury, maybe a back surgery or some type of a back issue that they've had. And those are hard to deal with. There are some new medications that we use for neuropathy. The most common ones you may have heard of are like gabapentin or Cymbalta or Lyrica. These are ones that they advertise. They all help, but they tend to be more for diabetics. And there's also a brand new treatment that we do in the office where we put stickers on people's feet. And it's 8% capsaicin. So it's basically taking chili pepper, you grind it up, make it 8%, put it on their feet. It hyperstimulates the nerves, and then the nerves calm down. And that's something that we do every 3 months for patients if they have diabetic neuropathy that's painful. But neuropathy is a big issue when you talk to people, as well as diabetes is a big issue. Sores are a big issue. So I put a couple of books here on diabetes. I have a couple of other books on like Achilles tendonitis. I didn't talk about that. Plantar fasciitis and wounds, if you guys want those.
I think it's also due to vitamin B deficiency.
So there are vitamin deficiencies, vitamin B12 deficiency, a lot of other vitamins, some folic acid. Some patients that are on metformin, they automatically become deficient of vitamin B12. So having supplementation with certain vitamins, this is a talk with your doctor about that. Usually, endocrinologist is treating a lot of the neuropathy.
And that's a problem for people who are vegetarians.
They don't eat as much meat, so they could have, and people that, yes, thank you. Thank you. Go ahead.
I have neuropathy of my feet, and I'm pre-diabetic, so my blood sugar is always right on that borderline. And I went to my doctor and I said, if I cut back all my sugar, he said it won't really help.
So with the neuropathy, right? Neuropathy is a challenging diagnosis. I think if you reduce the blood sugar greatly, I think it'd be good all around. And it may reduce some of the neuropathy pain. So it's really, but how many patients have I been able to see reverse their diabetes with diet? It's very hard. So there's very few. It's a hard thing to do. These new medications are making it easier though.
I have neuropathy, and sometimes I feel like just take my shoe off. It's much better.
Take the shoe off.
Is that? And it's not every day that I have.
Yeah.
Just certain times. I don't understand why today and not tomorrow.
Yeah. Is it in your feet?
What?
In your feet, right?
Right.
Yeah. Neuropathy is challenging. What my patients tend to tell me is that, because I don't have it, what they say though is it tends to make it worse at nighttime when they're in bed.
Yeah.
But I think part of the reason for that is because during the day you're busy and you're not thinking about your feet. When you're sitting in bed at nighttime, you're thinking about everything of the day. Another thing that can help is you can soak your feet sometimes, either in hot or cold. That can help a little bit. You can put on socks. Some people actually, there's different pressure receptors. So if you have a tight sock on, it may overpower that neuropathy type of feeling for your sock. And there are some creams you can put on, like chili pepper creams, BioFreeze, other things like that.
What's the cause of, say you're sitting in front of a computer for a while, and like your foot falls asleep? What causes that?
What happens is when your knee is bent on the chair for a long, you're getting called a neuropraxia, meaning you're pinching your nerve slightly because of the position that you're sitting, and it goes to sleep. And because it cuts off the blood flow to that area, and then it comes right back. But it's caused by pressure, because you wouldn't have it if you're not sitting down or crossing your legs or something else like that.
People who have neuropathy, if sitting down all day doesn't help, does it?
It doesn't. I don't think it affects it at all. It doesn't affect it. I don't think sitting. I think we say sitting is the new smoking. Sitting is the new smoking. We sit so much, so it's good to get up and be active. Try not to sit. Okay. Oh, go ahead.
Back to the fungus issue you mentioned, the oral medication that you said instead of the topical. Now, are those antifungals?
So the oral would be terbinafine.
Is it antifungal?
It is an antifungal.
But the antifungals are not good for people who take heart medication with statins.
I agree, but you have to see what is your priority. And I have patients all the time that are on statins, because statins are also processed in your liver. That's the reason, okay? They're processed in your liver. You don't pee out a statin. And so as long as, in my opinion, in my hands, when I do a LFT, liver function test, and it's normal, I'm okay with you taking the oral medication for a short period of time. That's my comfort level. I know some doctors, they would pause the statin for a few months and then put them on the medication. But I think I'm more concerned about your heart than I am your toes. So I'm okay, and sometimes we'll repeat the LFTs midway.
I mean, that's what they did with COVID, was antifungal, and if you were taking COVID medication, and they asked you to stop taking statins.
Yeah, so sometimes they pause one. I haven't saw a lot of harmful effects, and I give it out a lot. It just depends on your comfort level, I think.
Why does statins sometimes affect people's joints?
And it makes everything hurt, right? It's sometimes joint pain, leg pain. I don't know. I don't prescribe those. If anyone else knows,
Just one of the side effects of
I think it's just one. It's one of the side effects. That's all I know. I hear it all the time.
Is it possible to reverse Raynaud's?
Raynaud's. So Raynaud's is where your toes or fingers get red in the wintertime. Okay, it's similar to frostbite. You can't. Yes, you know how you reverse it?
Warm them up.
Move to Florida. If you move to Florida and not New England, you would be okay with Raynaud's. But I put a few things if it's helpful. Hope you guys enjoyed this. Thanks for inviting me, Bill.
Thank you very much, Dr. Pelto. I hope you found that really interesting. I certainly did.